caregiver when it comes to safety training. Your work on your own is to prevent accidents. Make sure the hallways, they are not cluttered with the objects, chairs, or such that they will prevent you to move quickly or to act quickly when there is an emergency, right? Also make sure that there is good writing, isn't it? Because you cannot walk properly when you cannot see where you're going. So always make sure whether you're using the wheelchair, the bed, they are properly on brakes, everything they are working well. And if something is amiss, you know who to report to, either to your supervisor or the provider, so that whatever the problem is can be fixed. Okay? So you also prevent injuries, use proper tools when doing every task. You want to protect yourself, you and others. The other one, what you're supposed to do is to stop the spread of infection and diseases through proper hand washing, isn't it? Yeah, proper hand washing. It's called international standard precautions. You wash your hands properly, use of gloves, okay? Cleanliness is very, very important. Prevention of blood-borne pathogens, treating all the fluids as if they are infested with some germs. You have to know how to break the germ cycle. The other one is how are you prepared to handle the emergencies? You call 911. You suspect that there is a life-threatening situation with the client or with the environment where the client is. You immediately report so that the issue can be resolved before it spills out to something else. What are some of the safety guidelines? You take care of your back. You've seen, isn't it? Yeah? You don't bend, you squat, isn't it?
Yeah.
And when you're lifting objects, you're not lifting objects with the weight of your shoulders. Rather, you are lifting weight with your thighs, isn't it? So it's very, very important. So make sure you use proper body mechanics. Make sure that you wear closed-toe shoes, slip resistant, that you cannot skid and fall, or sturdy shoes, or such as tennis shoes. They will help you, and also comfortability when you're working. Then another thing you need to do is to be on the lookout, and you eliminate safety hazards. You cannot be cooking and at the same time you are doing laundry, isn't it? Yeah, isn't it? There are some activities that you cannot just multitask, isn't it? You have to complete one task before you go to the other task, and that will help you to eliminate safety hazards. Maybe the house is burning when you are busy doing laundry downstairs, isn't it?
Yeah.
So you have to eliminate safety hazards. Know and practice proper procedures if a client falls. Remember, you are a mandatory reporter, meaning you are required by the law. You are required by the law to report, isn't it? So follow the proper procedures, call 911, inform the provider or the supervisor, write incident report. An incident report is like a statement that you write. You explain what happened from the beginning. There are no secrets. Don't hide, because when you hide, and then the clients will be in danger, or they'll find out later, then you will not know how to explain yourself what happened. Always make sure, hey, I was taking this client to the washroom, and then he pushed himself and fell. I called 911. He was taken to emergency room where he was discovered he had a nerve fracture. Yeah, he was treated. I informed the provider. The client is home recovering. Well, you have to write a statement of what happened without hiding anything. Okay. And if you're told to write the same statement like forever, that is what you're gonna write. They have to be consistent. You cannot say this today, then tomorrow you say something else. Okay?
Yeah.
So it has to be truthful to the best of your knowledge. So proper practices and proper procedures if a client falls, and also you have to document. It's called document. They say that whatever is not, if something is not documented, it did not happen. If you give medication and you did not document, then it means that you have not done it. So always make sure you document, okay? And also you report any health hazards that may come about. Any question?
No.
Okay, if there's no question, I think we come to the end of today's class, and we'll continue from there tomorrow.
Okay.
All right?